Good day everyone, I am Regional Aradaza. For today, I'm going to demonstrate about Leopold's maneuver. The materials needed are stethoscope, tape measure, gloves, and a cloth, rolled cloth. Make sure to provide privacy to the patient. Good day, ma'am. I am Regional Aradaza from Mr. Niti College of Ormoc. I am going to be your student nurse for today. Ma'am, can you please state your name and your birth date, ma'am?
I'm Clarissa Ato. I'm born in January 28, 2000.
Thank you, ma'am. How would you like me to address you, ma'am?
Clap.
Okay, Fla. Now, I am going to explain the procedure to my patient. So, ma'am, today I am going to explain to you the procedure of this assessment. So, this procedure called Leopold's maneuver, it means four maneuvers, and this is important for us to know the fetal presentation and fetal lie of the body inside your womb. So, ma'am, before we start our assessment, you can first urinate in the restroom so that there will be no discomfort once we start our assessment. For the next one, I will do the proper hand washing to prevent infections or spreading the microorganism. This time, I will use warm water. So, allow the pregnant woman lie in a supine position with slight knee flex and provide small pillow and put it in her back so that it will not cause a supine hypotension syndrome. So, ma'am, please allow me to remove the blanket and expose your belly. So the first semester of fundal grip will be assessing for the presentation of the baby or fetal lie. So we're going to be assessing if it is breech, cephalic, you can see if it is breech. Is it round, hard, and it is movable, but if it's round, soft, it is supine. So I will be facing the client and I will perform the triangle. So you're gonna palpate here. And observe necessary findings. So now, let's move to the fundic height measurement. So now, I will be using the tape measure to measure the fundic height measurement of the baby. So I will be using the centimeter part. So the zero line must be the symphysis pubis, which is located here and following to the abdominal curve. So for the second maneuver, we are going to palpate on the side of the uterus. So we are going to be determining the fetal back because it is important for us to know where we can auscultate the fetal heart sound. It is important because we will be placing the stethoscope to determine the normal heart rate of the baby, which is 120 to 160 beats per minute. So now, I will be palpating right here. So observe that my left hand is stationary and my right hand is moving from top to bottom. And vice versa, my right hand will be the stationary and my left hand will be moving from top to bottom. You can determine the fetal back because it is flat, having a resistance, surface, and hard. So now, let's proceed to the third maneuver or the Paulik's grip. So in here, I will be using the L shape on my hand, which is the index finger and the thumb. So I will be placing it to above the synthesis pelvis of my patient. So I will place it in here. So we're going to be observing the degree of the engagement. So if this moves when you move it side to side or when you move it upward to lift up the head, because some other institutions do that, it means that the fetus has not engaged. But if you move it and it is movable, it means that is engaged. For the last maneuver, we'll be doing the pelvic grip or the fourth maneuver. So the first, second, and third maneuver, we are facing the client, but in the fourth maneuver, we are going to be facing in the foot. We're going to start here. We're gonna have approximately 2 inches into the inguinal ligaments, so we're gonna be palpating it downward motion, so the sides again. This also somehow confirm the second maneuver, which is the umbilical grip. In here, we're gonna be doing determining or assessing the degree of flexion by palpating it. So once when you're done with your assessment, make sure that your patient is in comfortable position. Don't forget also to wash your hand and note the unusual findings and the findings that you found in your patient.